Hello, my name is Mimi Borelli. I'm going to discuss outcomes of the use of fresh frozen costal cartilage in rhinoplasty. When surgeons perform rhinoplasties, which are surgical procedures done to reshape the nose, sometimes there is need for additional cartilage to create the desired structure, and often this is used to reinforce the septum, the part of the nose that lies between each nostril. Surgeons and patients have a choice of using either synthetic material, man-made material, which can be designed to mimic the properties and functions of natural cartilage, or biologic cartilage, which comes from a living or deceased donor. Broadly, there are two main sources of biologic cartilage that are used. A patient's own tissue can be used, and this is called autologous tissue. However, every time donor tissue is used from a patient, this creates an additional wound and an additional place to heal, which may not be desired by the patient. Alternatively, cadaver cartilage tissue can be used and then prepared in a way to make it safe for application into a human. There are different areas on a cadaver where cartilage tissue is sourced from and different preparation techniques. A technique which has gained popularity in recent history is harvesting cartilage from the rib cage, known as costal cartilage, from fresh cadavers and freezing it immediately to prepare it for application into a human. With the emergence of a new procedure or technique, it is critical to ensure that the outcomes achieved using this new procedure, specifically the complication rates, do not exceed those performed using their old procedures. The authors looked back at all of the outcomes from a single surgeon who had been performing rhinoplasties using fresh frozen costal cartilage. Over this year, they found 282 cases. Reassuringly, the patients they reviewed were representative of the typical patients that would have a rhinoplasty. They were mostly male and they were in their 30s. Secondly, and the main outcomes of their study, they found 2% of their patients roughly required antibiotics postoperatively, a very similar rate to that reported in the literature in prior rhinoplasty procedures. They also looked at changes in the shape of the newly reconstructed nose. They reported 0 patients had any change in the shape of their newly reconstructed nose over time. This enabled the authors to conclude rhinoplasty using fresh frozen costal cartilage is a safe, convenient, and patient-centered option for graft tissue in rhinoplasty.